And like for some of those drugs too, like say the ones that you've chosen for like mental health, have they been around for a long time, or is there like constantly a lot of them coming out?
Yeah, so there's always new and better.
Mm-hmm.
New and better isn't always new and better.
Yeah.
I mean, despite how it's kind of like, any consumer good, the next one, the new one, it's better, it's newer, it's faster or whatever.
Yeah.
So I tend not to jump on bandwagons. Like if there's a new medication out there and they're saying all these wonderful things about it, I'll often say, well, why don't we just wait,
A little bit.
a little bit and see what the experience is.
And do you see them like drop off? Like say someone launches a new medication and they come and sell you on it. Does it stay on the market forever, or they just go, okay, like no one's really using this, they must have to not sell it? Or is it really large companies constantly trying to create new things?
Yes, there's always this is a whole area, fascinating area. So it used to be you created the drug, you get the patent, you keep the patent of that drug, you're the only one that can make it and sell it.
Okay.
And then they decided that, well, that's not okay, because then you can just artificially keep the price of your medication high. So they have limits on patents. But what's happened now is that means any new drug that comes out that's really good, the company that did all the R&D has to get all their profit out of it within the first number of years, because then the patent expires and then the generic drug companies can make it.
Oh, so you can't hold that patent forever.
No. So like Viagra brand, like you heard the commercials, there's now a name brand Viagra, right? So they had to get all their money out of it when they first released it, right? And now the generic can make it, so they can't get their money out. So actually not artificially, it makes usually often newer medications are more expensive initially because the drug company's trying to get all their money out of it before their patent expires. So in answer to your previous question, medications that are good, that work well, stick around.
Okay.
So if there's a really good medication for blood pressure and it works and it's safe and you don't have side effects, it sticks. Eventually it gets cheaper because the generic companies start making it. If there's a medication for blood pressure that had some significant side effects, didn't work that well, it'll drop off. They'll stop making it. But you're probably right. Like in probably some degree of a cycling, and a new medication comes up, everybody says all these wonderful things about it. The sales go up and the use goes up. And then probably it filters down to the level that it should be.
Yeah.
And then if it's something else comes along that's better, then that's going to probably drop off the back end. Like we don't put leeches on anybody anymore. Because people, we don't bleed people anymore.
No.
And 50 years from now, I'd like to think that's not going to happen, but there's going to be a bunch of docs sitting around going, can you believe that 50 years ago, this is what they used for this problem? So, because things evolve, right?
Yeah,
so,
can always be the case.
Yeah, and you even look at the mental health, the things that people used to do to treat mental health, insulin-induced seizures, lobotomies, all sorts of like shockwave therapy without any sedation. Locking people up in asylums. I mean, we're evolving.
Yeah.
Right.
Yeah. I even talked to my grandpa about it because I was curious. I was like, man, like, was this always a thing? Like when you were 20 or like younger, what did you call it, or what was it like back then? And even doctors, he was like, man, like now there's like neurosurgeon doctors, psychiatrists, like all these different people. He's like, back when I was like 15, 20, like you go to the doctor, they do everything. He's even dentist. He's like, doctor pulls your teeth, doctor does your broken leg. Like there was just a doctor. There wasn't everything else. And he said that basically, like if they thought you were mentally ill, they just sent you to like a mental illness, like a insane asylum, and that was it. Like that's where you went.
Yeah.
That's
goodbye, Bob. Have a good life. Yeah. It's pretty sad.
Mm-hmm.
A lot of sad stories. And I mean, definitely we've come a long ways from that, but I still think there's a long ways to go for mental illness. Even if you think about shockwave therapy, since I brought it up.
Yeah.
It actually has a role. So, people say, what? Well, for whatever reason, having a seizure, it's like reset up, you're rebooting your computer. And it seems to really make a difference to people who have treatment-resistant depression, psychosis, that often actually ECT will actually make a huge difference to someone's life. I've had a few patients have it, and it's been a lifesaver for them.
Really?
And but the way they do it now is they give you a general anesthetic. They put you to sleep, and they actually give you medications that paralyze your muscles. So it's like when you have your gallbladder out, it's the same procedure, and then they induce a seizure in your brain. So
so it's not like having a crazy body seizure.
You don't thrash around, and you just the electrical activity of a seizure, which is that's essentially what it is. It's unrestrained electrical activity that spreads around your brain happens with you just lying there peacefully sedated. So
and that's done through the medical system, like in a hospital.
Yes. Yep.
Oh, that's cool. I've never heard of that before.
Yeah, and again,
like
it's for really sick people.
Yeah.
Kind of like thinking about like if someone has a heart that's failing, the ultimate thing is a heart transplant. I mean, that's for the really, really sick, right? So
yeah, it's kind of like maybe
you don't have a little chest pain, and I go, hey Shelby, you ever thought about a heart transplant?
Yeah. Although I would have maybe liked that back in the day.